Quadraped Level 1. In the Quadraped Level 1 exercise, what you're going to do is exactly what you just saw here, but there's some very specific details. Those specific details start with the upper body motion. But what's going on here is also very important regardless of whether the upper body or lower body is moving. What needs to happen here is staying in a neutral pelvic position. So this here would be an anterior pelvic position. This here would be a posterior pelvic position. You want to be right there about in the middle. Maintaining that position, drawing in, sucking in the abdomen, a little bit of transverse abdominal contraction. Then the focus becomes when this arm lifts, as soon as it goes off the floor, so Dr. Gabby, go ahead and just go just a little bit and pause right there with your hand. Perfect, off the floor, exactly. So as soon as the hand lifts, the scapula is going to go into depression. So go with scapular depression. Yep, without altering the alignment of the thoracic spine. Scapular depression and external rotation, trying to bring that scapula congruent with the rib cage, and then lift that arm all the way up. Good, and then back down. Same thing on the other arm. Then you'd go from left arm to right arm. Scapula into depression and scapular external rotation, congruent with the rib cage. Go ahead and lift the arm. Good, and back down. Good. Now it becomes really much more of a focus what's happening with the pelvis, because as the leg goes first back, kind of skimming the floor, and after it skims the floor, lifting up, keeping that neutral pelvic position, come up higher, 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 to full hip extension while trying to maintain neutral pelvic position. So if this pelvis tips a little bit into the anterior position, a little bit, that's okay. But really you want to try to keep it neutral. What you don't want to happen is this excessive hyperlordosis in the lumbar spine. You don't want to see that. You want to maintain this neutral pelvic position when you bring the leg back, and then bring that leg down. And then onto the next leg, so onto the last fourth limb there. Lifting up, so skimming the floor, and then she lift the leg completely, keeping the pelvis neutral. For fitness doctor practitioners, the thing that you want to know, as in many of these biomechanical optimization exercise progressions, and that is, what is to come? What motion, what alignment position are we really training for? And in this exercise, what we're really training for is being able to maintain the scapula into that scapular stabilization position of scapular depression, retraction, external rotation, while the shoulder is going into flexion. So very importantly, you're looking at your client and making sure that that alignment position is really in kind of a perfect setting, perfect position while the arm is moving. And also, of course, that the pelvis is neutral. You need to get involved with the client, adjust their pelvis as needed, help them maintain neutral. You may need to keep the hands here on the pelvis while they're bringing that leg back. Don't just verbally tell them, especially if they're doing misalignment or movement compensations like anterior pelvic tilt to bring the leg up higher. You need to get involved, coach them, and help them align.